2, 1, start.
Hello, my name is Shala. I'm a PN3 student of George Brown College. I'm here today to perform a neurological assessment on my patient. Please, can you introduce yourself?
My name is Galila. I was born March 21, 1979.
Okay. Can you also give us consent for this video because it's going to be used for educational purpose?
Yeah, I give my consent to be recorded.
Okay, that's good. So, Galila, today I'm going to be performing a neurological assessment of you. So I'm going to be asking you a couple of questions and I'm going to be touching you. Is that okay?
That's okay.
Okay, fine. So I'm going to provide privacy and I'm going to ensure the lighting is okay, bright enough. And I'm going to perform hand hygiene. So, Galila, I'm going to identify you properly so I have the right patient. Can you tell me your name and date of birth, please?
My date of birth is March 21, 1979.
Okay, good. Do you know where we are right now?
We are in the George Brown third floor.
Okay, do you know what date it is?
23rd of March 2022.
Okay, good. So I can see that my patient is oriented ×3 and he doesn't have any speech deficit or slow speech and is cool, calm and cooperative. So Galila, I'm going to ask you further questions. Do you have headache?
No, I don't have any.
Alright. Do you have any prior head or brain injury?
No, I don't have.
Do you feel tremors?
No, I don't feel any tremor.
Okay. Do you have any weakness in your body?
No, I don't have.
Do you have any problem swallowing?
No, I don't have any problem.
Okay, so that's fine. So the next thing we're going to do is to test for your cranial nerves. So it's 1 to 12. So I'm going to start with number 1, which is olfactory. So I'm going to give you 2 different familiar smell. I need you to occlude one nose and close your eyes and tell me what you smell.
This is alcohol.
Okay, please close the next nostril.
This is coffee.
Okay, that's good. So that is working properly. So the next one is your cranial nerve 2, which is the optic nerve. So I'm going to need you to stand 20 feet away and tell me what you can read on this wall. Line 1.
I can read line number 8.
Okay, what do you have on line number 8?
Rate P Q R S T.
Okay, and you can read all the lines before line number 8.
Yes.
So that's perfect. So it means you have 20/20 vision. It means you can see from 20 feet away what a normal eyesight should see. So the next one is cranial nerve 3. I'm going to do cranial nerve 3 and 4 and 6 together. So this is the oculomotor, the oculomotor, the trochlea, and the abducens. So I'm going to check for what we call the color test. So I need you to cover one eye and follow this. Okay, that's good. I can see your pupil moving. Okay, that's good. So this test just showed that you have voluntary eye movements. There's no involuntary eye movements. So that's fine. So I'm going to go next to cranial nerve number 5, which is the trigemia. So I'm going to need you to clench your teeth. Okay, so I can see it's there's bilateral, it is symmetrical, it's not swaying to one side. So I'm going to move over to cranial nerve number 7, which is the facial. So I'm going to check for your facial muscles. So I need you to wrinkle your face. Good. I need you to puff your cheeks and blow puff out of your mouth. And also smile. Okay, so that's good. So it means your cranial, your facial muscles are working. So the next one, I'm going to check for whispered acoustic cranial nerve number 8. So I'm going to check the whisper test. I need you to occlude one eye and tell me what you hear. Occlude, okay, and tell me what you hear.
Cotton candy.
Okay, good. So that's good. And then the second one.
Cat and dog.
Good. Good. So that is the cranial nerve. So the next one is the cranial nerve number 9. Cranial nerve number, cranial nerve number 9 is the glossopharyngeal. So I'm going to check for your gag reflex. I'm going to palpate your uvula. Sorry. Okay, so that's working. So cranial nerve number 10. I'm going to perform what we call the phonation test. I'm going to require you to say ha. Okay. All right. That's very good. So cranial nerve number 11. I'm going to test your spinal accessory muscles. So I need you to shrug for me. Okay. Yes, that's good. So there's equal strength on both sides of your body. So cranial nerve number 12 is the hypoglossal. So I'm going to check. I need you to wiggle your tongue from side to side. Okay. Okay, so that's good. It shows there is everything's bilateral and you can move your tongue properly. So that concludes the cranial nerve test. So the next one we are going to do right now is motor test. So the first thing I need you to do, I need to check for your tone, for your extremities tone, strength, and the tone, strength, and the size. So I need to check they are okay, they look symmetrical. Okay, that's good. So, and the size and the strength. Yeah, okay. So they look there's equal strength in both extremities, so that's fine. So the next thing I need to check for is your gait. I need you to walk and take 6 steps back and forth. Okay, that's good. So you're walking properly, you're not swaying from side to side. So the next one I need you to do is the tandem walking. You walk touching your heels with your toes and take 5 steps back and forth. Just okay, that's good. Oh, perfect. So that is the tandem testing. So the next one is called the Romberg test. So I need you to do this. I need you to close your eyes and spread your hands. Close your eyes. Okay. So I can see that is working very fine. You are not swaying, you are not losing balance. So that is okay, you can see. So the next one I'm going to check now is the cerebral function. So I'm going to check the rapid movements. I need you to do this on your palm. as quickly as possible. Yes. Okay, good. That's perfect. So the next one we are going to do is the finger to thumb. So I need you to touch all your fingers as quickly as, use your fingers to your thumb, yeah, as quickly as possible. On the second hand as well. So that's also equally good. So the next one is finger to finger. I need you to touch my finger and your nose as quickly as possible. Oh, okay, that's fine. So the next one we are going to do is finger to nose. So I need you to close your eyes. Close your eyes and touch your finger, touch your nose with your finger, with your eyes closed. Okay, that's also perfect. So the next one we are going to do is heel to shin test. You should lie down, but yes, can you just use your heel to from your shin downwards? You put it on your, yes, from your let me put off your shoes. Is that okay? So I need you to touch your yes, and trace it back to you. That's good. Can you do that for me? Okay. Oh, perfect. Okay. Alright, that's good. Thank you, Galila, for your time. That concludes our neurological assessment for today. Thank you.